Today, I'm bringing back a blast from the past, one of our first YouTube patients, so we can see what's going on. Hi guys, my name is Dr Sarah Tonks. I'm working as a cosmetic physician right here in London. Today we've got one of our very first YouTube patients coming back in so that we can see what changes have occurred since she was last in the clinic and what's next. People often ask me, that's great, yeah, I look fine, but what happens in 6 months? What happens in 12 months or a year? How does this result continue over that amount of time? Do I need to adjust it? Do I need to top it up? Help, what happens? The answer very much depends on exactly which treatment it is that we're talking about. So with Botox, it will probably last around 3 to 4 months. We first saw Jo in filming about a year ago now. I have seen her between the original filming and now, and we have done some Botox in that interim period. We've also done some filler as well, just a little bit of tweaking in the past year. I think we just did a tiny bit in the cheeks. Don't quote me on that, but I'm pretty sure that's right. Normally, a filler will last anywhere between 6 months to 2 years, depending on which product has been used and which area we've injected. It's very common, or at least it was, for patients to say, oh, the filler's all gone, I don't feel it anymore. Well, the fillers that we use now are very, very different. And actually, you won't really feel them in the skin, but the result will still be there in some form, even in the lip. So, for example, with some of the products that I'm using right now, like Juvederm Volbella or Juvederm Vollift, you'll often see that there is some kind of result at 1 year, 14, 18 months after the original injection has been performed. Now, you won't feel it in the lip, but you will see that there's a difference. One of the other things to bear in mind about dermal filler is, remember, you get that collagen stimulation next to where you've put the filler. So if you're using it for skin improvement, or even if you're not using it for skin improvement, you're going to see a skin improvement even 1 year, 2 years after all the filler has gone. I always advise my patients to look at it like you're giving a building dose initially. So you have to use quite a lot of product to get a good result, at least initially. And depending on the person, sometimes you have to kind of split that up, say over 3 or maybe even 4 different treatment sessions, depending on how much you're putting in as well. Once all the treatment is complete, you won't need to repeat that pattern again after, say, a year or 2 years. So say, for the sake of argument, you're using 10 mils, and then a year or 18 months later the person comes back. You don't need to use 10 again to get the same result. Say you just use 5 or 4 and it will give you the same result. Sure, if you were to use another 10, you're going to take them from, this point here to this point, because you're continually building and improving on what's gone before. That's why it's super important to get your injections done well, because if they're done badly and then you get this collagen stimulation, it can make you look kind of a bit weird. So do you remember a few years ago when it was really the vogue to have a lot of filler placed in the cheek in order to get lift? Well, that meant that there are now a lot of people walking around with kind of oversized, overfilled hamster cheeks. And that's one of the reasons why fillers got such a bad rep in the first place. It's because they were being used probably inappropriately. Now, you can still fill the cheek. You can fill this part of the cheek, this part of the cheek. It's fine. It all depends on what is there originally, anatomically, what that person has, and in which layer of tissue you're placing the filler. So my advice would be, don't place the filler in this part of the cheek superficially. You want it to be underneath the muscle. You want it to be deep there, so that when the person is smiling, it's not going to carry the filler up with it, and you won't end up with kind of these scrunchy up eyes and overstuffed hamster cheek. Not good. Pillow face, that's what they used to call it, isn't it? It's about 1 year on since we last filmed our patient here, and since then she's had a big birthday. She's now 50, looking really good, I think you will agree. But is there anything that we can do to maybe enhance what she's already got here? Well, I think it's just a case of maybe improving the skin texture a little bit. So You can see that she's got these sort of horizontal lines just coming around here and then here as well. The structure of the face is still really, really good. She's got killer cheekbones, an amazing jawline. Maybe just lost a little bit of volume in the middle part of the forehead and just a little bit here in the chin crease. It really is just a case of adjusting and maintaining the result that we've already created in the past. We really don't need to do too much for her. Just before we start, let's see a picture of how she looked last year. If you remember, she was one of the first ever cases that we did for YouTube. So her before is, well, it's really bad. You can't really see what's going on there, but we do have her after picture, which I'll just show you now. The lighting is a little bit different to how we're doing it now, so I will show you her before and afters, but it's not going to be exactly the same just because we light the shots differently. So let's see exactly what we did this time. We started by doing some toxin in the frown lines, the forehead, the bunny lines. Her bunny lines are super strong, by the way. The DAO, crow's feet, and in the neck, in the platysmal bands here, because again, these are really super strong on her. Gonna move over and do some dermal fillers in very tiny injections in front of the ear, and this is for lifting. Now we're doing next to the nose, which is one of those techniques, again, that I love doing because nobody ever knows that you've done this, but it does give you good lift. And then finishing up with doing some chin crease with needle. This is the fun part now. So I'm going in directly to improve these vertical lines. It looks kind of a bit like chickenpox when it's done, but it does settle down quite quickly. I have wanted to do this injection for her for so long, but she's always said, no, I just want to use Botox in my forehead. I don't really want to use any filler, but I finally got her to crack and agree to having some filler in the forehead. And here what I'm doing is just trying to round out the shape of the forehead slightly, make it a bit more curved. At the moment it's quite flat. I'm using this 32 gauge needle to do this injection. So let's go over and see what we got. This is one of my favorite realistic after results. So we haven't used loads of product like I do sometimes on the other patients on the channel. We've used a very realistic amount, but check out the subtle difference that we've got. So if you look at the forehead, you'll see that the way that the light catches the central part of the forehead is quite different. Over on this side, we're looking quite flat here. The second thing is you can just see that the way that the chin crease has been injected, it really does improve the shadowing that she's got in that area. And doing these small injections in front of the ear, it has given us a little bit of vectoring. So you can see that there is a very, very slight improvement in this upwards vector. The other thing is, you see these lines, the vertical lines that we've injected? See, they're still there, but they're much softer than they were previously. I am just going to show you her after pictures from a year ago and compare them to the after pictures that we've just taken after this round of treatment. So you can see the difference between the two. Now, bearing in mind, it's a different set, the lighting's different, pretty much everything's slightly different. So I know they're not gonna look exactly the same, but what I want you to see is the lip. I want you to have a look at the longevity of that product. So we have injected her lip in this picture here, and I haven't done anything to her lips between then and now. It's the same, so it's still the same lip filler that's in there. I know the lighting's different, but you can see that her lips still look really, really good, and that's because now it really does last a long time. If you were to touch her lips, they wouldn't feel like they've got filler in them, but you can see from the pictures that there's still an improvement. In fact, if anything, they look better than they did last time. That's because there's been more time for her to produce collagen in response to that filler being there. Also, take a look at the forehead. So we have done some injections in the central part of the forehead here, which were not present in the pictures that we took a year ago, and you can definitely see that there's an improvement in the convexity there. She has also had her eyebrows done, which does make a bit of a difference, to the pictures. So let's now take a look at her smiling. These pictures are from this treatment session, not from a year ago. They're both from now. And the reason I'm showing this to you is it's really for the lower part of the face. So you see on smiling here, you can just see a little bit of her lower teeth there. And then on this one, you can't see any of her lower teeth. And that's because we have added some filler in this chin crease here. So it prevents the lip from coming down quite as much on animation. But I think you'll agree, she continues to look very, very natural. Even after this more recent treatment. Okay guys, so that's it for today. I hope you enjoyed the video. Join me again next week where we're talking more about injectables. And in the meantime, don't forget to like, comment and subscribe to the channel. If you've ever had any of these treatments done or you're thinking about getting something done, don't forget to let me know in the comment section below. I'll see you next week.